Welcome to my DNP virtual presentation entitled Breastfeeding Promotion for Opioid-Dependent Mother Neonatal Abstinence Syndrome Infant Dyads. I am Jan Gill and was the primary investigator for this project, which was conducted during my Doctor of Nursing Practice degree preceptorship. Please join me as I walk you through each step of the project. I do not have anything to disclose. IRB approval was obtained for this project through two sources. In order to understand project need, it is imperative to briefly review neonatal abstinence syndrome, otherwise known as NAS. This is the physical withdrawal experience that neonates encounter due to in utero opioid exposure, which includes numerous substances which are either legally or illegally obtained. Central nervous system and gastrointestinal system irritation result in a myriad of unpleasant symptoms. NAS therapy involves treating symptoms using either pharmacologic or non-pharmacologic measures, often within the confines of a neonatal intensive care unit setting. Based on 2012 U.S. Department of Health and Human Services statistics, average length of stay is 20.7 days, which costs approximately $72,000 per case, of which 89% is billed to Medicaid. Given the startling increase in NAS cases, it is crucial to implement efficacious solutions. It is for these very reasons that breastfeeding must be promoted for this vulnerable dyad. Since breastfeeding affords this dyad multiple advantages in terms of health benefits and cost savings, it is critical to translate breastfeeding into NAS care. Since the small amounts of methadone or buprenorphine in breast milk are safe, breastfeeding should be advocated. In order for breastfeeding to occur within a realm of safety, the opioid-dependent mother must meet specific criteria. Despite strong recommendation from many professional organizations, providers remain reluctant to promote breastfeeding and implement this best practice feeding mode into NAS care. This further jeopardizes the already low 24 to 27% breastfeeding rate and limits benchmarking opportunities. In addition, breastfeeding promotion for this dyad meets all Institute of Medicine aims, which are essential to optimize healthcare outcomes. In order to truly appreciate the essence of this project, it is important to present background information. The project purpose was to promote breastfeeding for the ODM NAS infant dyad by meeting facility needs through resource provision, so NICU and perinatal assessment center nurses could competently assist this dyad. The breastfeeding policy needed to be updated to incorporate information specific to NAS. Nurses indicated they needed updated breastfeeding information that incorporated NAS, and PAC nurses requested a breastfeeding information sheet to distribute to opioid-dependent moms. The PICO question posed was, will a breastfeeding promotion initiative providing nurses and opioid-dependent mothers with breastfeeding education and resources specific to this infant dyad increase nurses' knowledge and improve breastfeeding rates? Utilized methods included resource provision for 2 hospitals within a system, which included 2 PACs, 1 Level 1 newborn nursery, and a Level 3 NICU. Education was provided for 22 white female nurses who voluntarily participated in a breastfeeding PowerPoint presentation, which included an 8-question pre-post test. Interventions included implementing the first 3 of 10 baby-friendly USA steps. The first 3 baby-friendly USA steps are highlighted on this slide. This was part of the project, which included updating the breastfeeding policy, providing the NICU and PAC nurses with a breastfeeding PowerPoint in service, and developing a breastfeeding information sheet for distribution to clients through 2 facility PACs. The highlighted information showcases the updates that were made to the breastfeeding policy. This is the breastfeeding information sheet that was developed for ODMs and distributed through the Perinatal Assessment Center. Metrics included evaluating nurses' breastfeeding knowledge using an 8-question pre-post test central to the breastfeeding education in-service. As well, breastfeeding rates were monitored at both facilities 6 months before the intervention and then for 6 months post-intervention. Interestingly, there were 15 dyads in each group, which was optimal for data analysis based on equal numbers. This primary investigator analyzed all data and received considerable assistance in this endeavor from the lactation consultants at both sites who are dedicated to accurately recording breastfeeding data. This process flowchart depicts all project processes. Results indicated that project goals were met since breastfeeding was successfully promoted. Initially, only 27% of nurses indicated having evidence-based breastfeeding knowledge, which increased to 100% after the in-service. Only 14% of participants had perfect pre-post test scores, indicating an 86% knowledge deficit amongst remaining participants. Fortunately, participants were able to improve their post-test scores by 12 to 75%. Following the in-service, median post-test scores improved to reflect a 12.5 to 37.5% increase in knowledge. On average, participants increased post-test scores by 2.6 points, resulting in a 33% improvement. This bar graph depicts post-test improvements in all 8 content areas related to breastfeeding promotion and neonatal abstinence syndrome. There was a significant increase in breastfeeding or use of breast milk, with rates increasing from 13% pre-intervention to 40% post-intervention. Formula use decreased by 50% and was attributed to the improved breastfeeding rate. There was basically no difference between combined formula and breastfeeding or the use of breast milk. In conclusion, breastfeeding promotion can be successfully accomplished through resource provision for nurses and clients. As well, knowledge deficits can be identified and addressed through education. Resources and education can also be provided to be sure that breastfeeding is occurring within a realm of competency and safety. This includes ensuring that opioid-dependent mothers meet breastfeeding criteria and nurses are providing them with best practice breastfeeding information. This project is an example of how interdepartmental initiatives can be successful to optimize NAS care. Recommendations include partnering with community organizations such as opioid treatment centers so that evidence-based information can be shared and health outcomes improved. I would like to extend a sincere thank you to the many individuals who supported this project. Thank you for your kind attention. A reference list has been provided for your convenience.